Welcome everyone to today's town hall. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Pleased as always to be playing a moderating role for today's town hall on May 13th. We've got a packed agenda as always. There's lots happening across the organization. We're going to have some presenters and then we'll have a chance for a question and answer period after that. You can of course pose questions to the presenters throughout the course of their remarks. You can do that using the Q&A tab at the bottom of your screen. I would ask kindly that everyone please try and use the Q&A tab, not the chat function, for asking questions. We'll reserve the chat function for our celebrations at the end of the Q&A. So everyone will use Q&A for questions, chat function for celebrations. It's as simple as that. And of course, if we don't get to your question, there's always lots of opportunities to provide you an answer in other ways, and I'll get to that later. So I see Rob was able to join us. I know he was part of the momentous LRT announcement today, which was going on for a while, but Rob, you're with us, so we'll turn to you to kick things off.
Thanks very much, Aaron. Yeah, just in the nick of time. It was a very exciting announcement of a $3.4 billion investment here in the city of Hamilton by the federal and provincial governments for light rapid transit. So anyway, that saga continues, and I'm very hopeful given this once in a lifetime opportunity for the city that city council grabs it and runs with it. Anyway, good morning, everybody. Thanks as always for taking time to join us for this town hall. As is the case since we started this regular series of town hall events, there's no shortage of information to share with you. The province recently signaled that the vaccine supply is expected to steadily increase as a result of a more reliable, predictable supply chain related to Pfizer and Moderna. So that's great. We're seeing more vaccines than we have to date. And earlier this week, the province also announced the acceleration of second doses for healthcare workers in highest risk categories, given the growing certainty of the vaccine supply. Planning to implement that direction regarding second doses is underway, and I anticipate we'll hear a little more about that today. But I'll just say it's on us locally to do that, and it's no mean feat to get that organized quickly. But I know we're working very diligently on figuring out a way to accelerate second doses, because we're certainly well aware how important it is to workers at Hamilton Health Sciences. I will say, beyond that, being vaccinated is really the principal way that we're going to outpace this pandemic. And for those of you that have not yet registered for a vaccine, just remind you that you can do that at any time. If you joined in or listened to the recording of last week's town hall, you'll recall the excellent work done by Hamilton Health Sciences physician, Dr. Dash Sedev, and a number of his colleagues who have been working on a national campaign called This Is Our Shot. It's a campaign that's dedicated to encouraging the vaccination of all Canadians and has been made available in over 30 languages. So would commend you to their website, thisisOurShot.ca. Beyond the stabilization of vaccine supply, we are seeing some positivity in the trending of COVID cases overall across the province. We've also, over the past almost a week, seen some reduction in the number of transfers that we are getting from out of region. So that's all good news. For now, though, in alignment with provincial directives, scheduled and planned care continues to be scaled back so that we can maintain the critical care capacity that we've added to our sites. In addition to our pandemic response, we're also working hard to maintain access to the specialized regional programs that only we provide in this area for non-COVID patients who may come to us from across the province. I want to thank everybody that's caring for our patients in units where they don't typically work. That is the product, of course, of this massive scale up that we've had to do in critical care and for COVID response. Also, my thanks to everybody who welcomed those redeployed folks and supported their colleagues in these temporary assignments, which I think are very challenging. While there is some very early planning around returning to returning services, surgeries and procedures that have been scaled back, and preparing to have a homecoming for people who have been redeployed. I think these moves are still probably a couple of weeks away at least, and will happen gradually. We will definitely share information and updates about those things as they become available. And just before I hand it back to Erin, I want to celebrate our nursing colleagues during this year's National Nursing Week. I know there have been a number of activities this week, including yesterday's Nursing Excellence Awards ceremony, which I was very pleased to attend, and which is always a really nice event. So congratulations again to the award winners, and a sincere thank you to everybody at HHS, no matter what your current role is. If you're a nurse, thank you very much for all that you've done for us over the past year especially, but as always, happy Nursing Week, and thanks again, everyone. Back to you, Erin.
Yeah, thanks very much, Rob. So next up on our agenda, our Executive Vice President of Clinical Operations and Chief Operating Officer, who's going to give us an update across our sites and services in our pandemic response and otherwise. Sharon, over to you.
Great. Thank you, Aaron. Good morning, everyone. And I'm going to get ahead of those celebrations too, and just echo Rob's congratulations to all the nurses for Nurses Week. And I too attended yesterday's Excellence Awards. It was great to not only hear about the winners, but also all of those that were nominated, and so many that could be nominated. So congratulations to everyone out there, and happy Nurses Week. Update this week, Rob touched on some of the areas that I'll provide a bit more detail on. The transfers, or the out of region transfers, have slowed down a little bit as of the week of May 9th. You see the numbers on the screen, just a few more than the previous week. And really much smaller numbers for HHS, the total to date being 88. Our planning in the HNHB region right now is really to look at some of our partner hospitals to accommodate the out of region transfers, given our Hamilton hospitals, including St. Joe's, sit quite high in terms of the percentage of acceptance of the out of region cases. Just a reminder to everyone that we still continue, despite being in a ramp down position right now for our surgical activity, continue to meet the needs for the time sensitive care, and certainly support all of our regional programs, and of course have maintained a fully accessible children's hospital as well. If we go on to the next slide. In terms of the specifics around the critical care capacity, we have maintained, it's an additional, sorry, it's a typo there, 38 ICU beds opened above our normal complement, which is another 43%, so quite substantive. We do have a plan if we should need to open further beds. We're not seeing any indication we would need to do that. However, today in the ICU, we have 93 patients. We have 34 patients in the ICU right now with COVID, and we have 55 on the ward. So much lower numbers, or at least a bit lower than we have seen in previous weeks as it relates to COVID. The other comment I'll make around the critical care capacity is a lot of work that has been done at the Hamilton General to establish the ECMO program and expand that program to meet the needs of the province as one of the provincial providers of that particular service. If we go to the next slide. In terms of how we're doing with our outbreaks, we only have 2 outbreaks at the moment. So that makes the pressures much less on the sites, and very good news to see only 2. All the work continues with our satellite health facility. We have the 3 floors open, 90 beds, slightly lower occupancy because we have adapted that unit for infection control reasons to keep the occupancy a bit lower. And the other work that's occurring is with home and community care as far as our post-acute transfers and our access to long-term care. This morning, there's 118 ALC patients at HHS. That's remarkable for us, and certainly numbers we have never seen before. And I expect those numbers to drop further as we continue to work with the long-term care homes and the strategy to enhance access. So that bodes well for our long-term capacity planning. And as Rob mentioned, we are certainly thinking about the 240 staff that have been redeployed to support various areas, primarily the critical care. It is too early to repatriate back, given we need to look at the modeling. We need to see what the COVID patterns will be and the health human resource demands. But there is a team actively working on what that process would look like, and we will keep everyone appraised of that. And the next slide. In terms of the mobile health unit, again, if you go to the hub, you can see a more fulsome update on where we're at. The work continues on the internal workings of the MHU. We remain on track should we need it, which we are hopeful we will not. But should we need to access the tent, it would be available at the end of May. We do work in collaboration with Sunnybrook, and as of today, they have 10 patients within their mobile health unit. And with that, I'll hand it back to Erin, and happy to take questions in the Q&A.
Yeah, thanks very much, Sharon, for that update. Next up, we have our epidemiology update from our Medical Director of Infection Prevention and Control, Dr. Dominic Mertz. He'll take us through what the state of the pandemic looks like nationally, provincially, locally. Dominic, where are things at this week?
Yeah, thanks, Aaron. I will start off here with last week's view. A couple of red arrows, as you can see. Moving to this week's, we were at 145 across Canada per 100,000 per week. This week at 131. Looking at the national numbers, Alberta still with the highest numbers, around 300, but now a green arrow. So it looks like they are past peak at this point as well. Nunavut's still struggling, but as I said last week, they quickly get high rates because of their relatively small population. So you're looking at 1 to 2 handful of patients on a given day, resulting in rates like that, while we, being in a similar ballpark when you're looking at cases per 100,000 per week, are in the range of 2,500 currently per day. Manitoba still increasing. You see a red arrow there, sitting at 215. And Nova Scotia seems to at least be at peak or after peak as well, despite the fact that it's still red there, but it looks like they are starting to head down as well, currently sitting at 117. Ontario, as I said, at 138. And on the next page, next slide, you will see our epi curve, how we had the peak in week 15, and over the last 3 weeks, we consecutively came down, and this week we expect to sit even lower. The black bar is where we are currently sitting. We might be even further down by the end of the week. So from a provincial perspective, things are certainly moving into the right direction at this point. On the next slide, you will see the hospital admissions. Again, the big red bars being a number of patients hospitalized that are COVID positive. Similar to what I've shown you before over the last 3 weeks here, you know, hospital admissions always delayed by 1 to 2 weeks, but over the last 3 weeks, you also see a steady decrease in number of cases. And as you can also see at the bottom, when you're looking at the darker red bars, And the second, the middle black line, showing you that number of ICU admissions are coming down now as well. Again, with 1 week more of a delay than we saw with total number of patients admitted. And we also see a reduction in intubated patients, where there's the lowest line and the deep dark bars. Next slide. How does that compare to the modeling? We are expecting new models to come out today. This is the one from a month ago, where the good news is we did much better than predicted. The red line showing you roughly where we are currently at compared to the 3 models that were presented April 16th. The models from a couple of weeks ago on the next slide, which were more optimistic than the ones prior. We are sitting somewhere between that green and that orange model, with currently roughly 2,500 cases per day. So certainly good news story here as well, in particular if you're looking at the trajectory that we are currently on. Next slide. ICU, probably the most important metric for us as a hospital and for the healthcare system as a whole across the province, where we had these very concerning models showing far more than 1,000 to far more than 1,000 ICU admissions based on the models from April 16th. Which thankfully never played out. We remained just below 900 at peak and now heading down, sitting at less than 800. Next slide. While this reduction in ICU numbers, this is the comparison to the modeling from a couple of weeks ago, still doing better than the best case scenario shown here. The reduction seems to have slowed up a little bit over the last couple of days, but again, we cannot, not look at those trends from day to day. It's really over several days that gives us an idea, but it looks like certainly from an ICU perspective, we are heading into the right direction as well, and much, much better than the concerns that we have had a few weeks ago. Next slide. Here, the Hamilton view, we had that peak roughly 2 weeks after Easter. Then cases came down relatively quickly. And then we have like a second peaklet. This may be artificial to some extent because we had those delays in reporting cases or cases getting into the system. So maybe not as much as an up and down as it may look like here. But certainly it looks like over the last week, yes, we are heading down. We aren't heading down as quickly as we were hoping for or our local models would have predicted, but the trend certainly is going into the right direction here as well. Next slide. And we see the same with a little bit more of a delay than at the provincial level in terms of hospital admissions here. ICU admissions start to come down as well now for the second consecutive week. We see less patients and quite a significant reduction in number of intubated patients compared to the week prior. So similar to the province, maybe not as steep a decline, but certainly on the right track within the city of Hamilton as well. Next slide. Okay, that's it for my end. Thanks, Aaron.
Dominic. Next up, we have Bruce Squires, our Vice President of Women's and Children's Health, who is also a key leader in our vaccination effort, to give us an update on the vaccine distribution process and what's new in that field. So Bruce, over to you.
Thanks very much, Aaron, and good morning, everyone. We thought maybe this week we'd start by showing a bit more about where we stand in our own community in terms of our levels of vaccine coverage. And I can even update a little bit the data on these slides because they're a couple days old, but hot off the press. We've actually had 228,000 doses administered here in Hamilton. And again, you can see that that's across a number of different channels, our own vaccination clinic, as well as other mass clinics, and then routes through mobile clinics, primary care, and through pharmacies. That 228,000 actually represents 44.3% of our 18 plus population in the city. So we're making good progress. If we go to the next slide, I think that, and hopefully you can read this, that you'll find it of interest. I certainly do, as we look at, particularly on the right-hand side, how we're doing across age groups. Of course, the strategy is to a large extent has been moving downward through age groups, and you can see that even for our population over 70, where all of those age bands are at or above 80%, and you can see we're pretty far in to 60 plus and making strides to 50 plus. And folks will know that it was actually only this morning that we moved to provincial vaccine eligibility for those 40 plus, and so we're already well on the way through some of the other mechanisms other than the provincial booking tool. We've also talked about how a big portion of the current strategy has been targeted at hotspots, and those have been defined as forward sortation areas or really postal codes, which maybe have experienced higher rates of impact of COVID, challenges with outbreaks, and other other factors that put those communities at risk or have resulted in lower vaccination rates. And so there's been a target here in Hamilton across these five postal codes, and you can see the far column in this report is the change from previous week, and the green represents the fact that that those are postal codes that saw the 5 highest rates of improvement in our vaccination rate over the previous week. And the column beside it, slightly to the left, represents where we stand in terms of vaccination coverage for that particular population. So good progress on 9C and 9K, still work to do in terms of L8L and L8N in particular. Maybe we'll go now to the next slide, please. So again, summing up the big picture, we're approaching 6.5 million Ontarians having received a vaccine, and again in Hamilton we're at 44% of the 18 plus population. Before I speak to kind of what's new, just a reminder that we talked about how May was a very aggressive month for the province in terms of the strategy and moving through eligible groups. That was driven to a large extent by additional supply, particularly of the Pfizer vaccine, but also the Moderna to some extent, and AstraZeneca. So the update in that group for this week was we moved earlier in the week to eligibility for all of the at-risk health conditions, to the rest of the cannot work from home group, which is a very, very large group of employees in a multitude of workplaces who are now eligible to book. And then this morning we've moved to 40 plus eligible across the province. Next week, it's going to be a further age-based adjustment to 30 plus. And the following week, the week of May 24th, is when eligibility is open for everyone over the age of 18. So what's new since I talked to you last week? Well, the province did yesterday announce the pediatric strategy really following the approval by Health Canada of the Pfizer vaccine for those ages 12 and over, and following the recommendations submitted by the pediatric vaccination table, which included our own Dr. Jeff Pernica and their advice. And so that strategy has been identified as providing eligibility as of June 1st, with an expectation that first doses will be available and in arms for all youth between the ages of 12 and 17 by June 30th. And the province has also indicated that they intend to have second doses for that group by August 22nd. You can tell this is obviously aligned to the school year. The details for exactly how that strategy will roll out are in active development. Certainly expect that a significant portion of that will be through our mass vaccination clinics, but there will also likely be targeted approaches using the schools. The second other very large announcement this week was the announcement on the recommendation of the vaccine advisory table that Ontario has immediately, as of yesterday, paused the rollout and administration of first doses of AstraZeneca. And as you could see, that's related to the risk in some incidents, but still low, of the rare blood clotting condition, VITT. That is not a pause or an official pause on administration of second doses. However, the work continues to happen provincially on how those second doses will be administered. And secondly, and there's lots of discussion, of course, around whether in fact there will be, if we can call it a vaccine mixing strategy that does allow for the second dose to be a different vaccine or even a different type of vaccine than the first dose. So again, lots to come on this, we expect in the very near future. Next slide, please. The other thing, and Rob alluded to it, that's very new, is the province announcing on Monday morning that highest risk healthcare workers are eligible to receive a second dose of the vaccine at a shortened interval. As Rob also mentioned, we have a very diverse group of HHS leaders and specialists who are working with colleagues from St. Joe's and the city to implement a timely, rapid, and effective solution to how we're going to implement the province's direction here. At this point, we just don't know the details, the format for that acceleration, because we are actively working it. As soon as we know, I can commit, as soon as we know the approach that's going to take and the exact timing, and it is on a rapid cycle, then I can commit we'll communicate that out quickly and extensively to our teams. We are very keen on this. It's a very it's a very important adjustment in the provincial strategy, and we're certainly working diligently with our partners to make it happen. The list of who's eligible for that shortened second dose is available at the link that's identified there. Essentially, it is the same as what originally was defined as sequence 1 in our original classification system, thinking back 5 months ago, or what later was referred to as the highest risk healthcare group. So recognize there are lots of questions on this. Unfortunately, the details on how we will do this are not yet available, but we certainly will put those forward as quickly as possible, as soon as they are available. If we can go to the next slide. Of course, we continue always to be interested in the vaccination of our own patients. And so we are moving effective next week that we will have a weekly cycle of inpatient vaccination at the Juravinsky and the Satellite Health Facility on Thursdays, and then the HDH in St. Peter's on Fridays. In particular, we're focusing on those en route from ALC to from alternative level of care beds to long-term care, retirement home and congregate settings. As we know, those are highest risk. But we will also have a process to connect list of other inpatients requesting a vaccine, and we'll work to vaccinate those. And of course, because there are a multitude of environments now for the second doses, for vaccine doses, we'll be able to refer them to the other appropriate locations. So I think that that really does wrap up our update for this week. Recognize that, again, lots still happening on this file, and so please watch for additional communications. And as Rob really said off the bat, encourage and support vaccination for each of us, our loved ones, and our colleagues in the community. And the This Is Our Shot campaign is one of the wonderful ways to support that vaccination confidence. With that, Aaron, back over to you.
Yeah, thanks very much, Bruce. And I know we did have a number of questions. Many, as always, will have a chance at the end. I'm sure Bruce will also take an opportunity to respond. We'll get to that in a moment. Presenter, Kirsten Krall, is our Vice President of Quality and Performance, as well as our Chief Nursing Executive, and is here to talk a bit about Nursing Week, which is well underway. Kirsten, over to you.
Thank you, Aaron, and happy Nursing Week to our 4,000 strong community of nurses across Hamilton Health Sciences. This week from the Canadian Nursing Association, the logo is "We Answer the Call," and it's so appropriate for all of the very hard work that's happened, especially during COVID. But as Rob had mentioned earlier, our nurses answer the call many different ways every day. So we're very proud of the many different nursing roles and the exemplary depth of knowledge and experience that serves the people of Hamilton, our region, and the province, which is very prominent at this point in time. You know, HHS nurses have demonstrated significant strengths over this period of time. Although we know, there's been massive change that's occurred, many fears and worries, understandable, but the strength of people has been amazing, and how people have really gelled together to have each other's backs and to look after each other and their patients and families has been remarkable. I would say wave 3 has been one of the toughest times for us as we've had so much more change with the redeployment of individuals to critical care areas. But we are so grateful for the significant adaptation that nurses are showing, for the many extra efforts that they've put into the work, including, picking up shifts, helping to stay late, to assist each other, lots of teaching going on. And of course, many themselves have been very keen to take advantage of learning opportunities across the organization. Nurses work in so many different roles in every part of our hospital. They are united in their dedication and resolve to being ready and responsive to whatever scenarios have come their way. We honor our nurses for their intimate human-to-human interactions that impact our patients and their families' abilities to cope, to learn, and to heal. I will just shout out our more senior staff. Thank you for your generosity and mentoring nurses new to the profession or new to a specialty area, or perhaps to students learning to become nurses. And I'll just do a shout out for the 100+ nursing externs that have been at HHS, and we have the privilege to have the extern program continue to the end of March. To the nurses who are new to our profession or new to HHS, we're also very grateful that you've chosen to be part of this dynamic Hamilton Health Sciences community, and to soak in as much learning as you can, but also to having the courage to try new things and to provide refreshing perspectives from your various different experiences. In the slide here, you'll see that we've got a number of activities that have been occurring for Nursing Week. Of course, our in-person events are certainly continued to be curtailed, but a variety of different other activities have been underway, and I thank Carissa Cordon and the working group around this planning process to really pull off a week that's been marked with every day having something going on. Last night was Make a Noise campaign. So we invited our communities to try and make whatever noise they could in the evening, but we are grateful also to our first responders of police, ambulance, and fire who did salute to our different organizations. And there's actually a video clip posted by Hamilton Police if people want to have a look at it. But it was a nice response to making noise and doing that celebration with our staff. There are other things that are going on this week as well. We continue to have our We Answer the Call social media activity going on. So keep tabs of that and contribute. There's some really nice e-cards on the hub. If you go into the HR recognition tabs, you'll see some really nice e-cards that you can send to colleagues. And believe me, we had our award ceremony the other day, and these personal recognitions of individuals go such a long way. So try and take a moment to shout out for some of your colleagues. Tomorrow is the Springing Forward event. It's a resiliency event that's offered. Lots of activity on our social media on the hub. You'll see the details around how to connect into that by way of Zoom as well. And it's really just intended to be a very nice moment for reflection, and that's really an important part of Nursing Week, but also for all of us. It's important for us to step back and think about the very many positive differences that we make to the lives of patients and families, to this hospital and to our community and to our families as well. So many thanks. I will also just very quickly just remark on our award winners. So we had 40 nominations and for individual awards or Nursing Excellence Awards, and 19 team nominations, which was pretty phenomenal. We know many teams deserve this recognition for sure, but we did have a great opportunity yesterday to celebrate individuals. I'll just shout them out, but more details about these individuals are also on the hub. Christina Carter, who is a nurse practitioner in pediatric neurology, got her Innovation and Quality Award. Kayla McKinnon got the Mentorship Award, RN on C3 Oncology and the GI unit over at Juravinski. We have 2 leadership awards, Marilla Anton, who's a nurse clinician with regional rehab, Krista Bennington, who is a RN clinical manager for hematology, oncology, pediatrics, both inpatient and clinic. Our Patient Experience Award for Jody Hagan, RPN in the medically complex care unit at St. Peter's. And then the Nightingale Award for Sarah May, Employee Health Services, RN, covering the St. Peter's site. So remarkable stories about each one of them, great nominations, but also such heartfelt comments about what that award means to them. We also had 2 team, we have 2 Team Excellence Awards, but the group that was reviewing the nominations had a hard time making a decision because we had 2 great nominations from our ICUs, both at Juravinski and Hamilton General East South. So they both got awards and some nice plaques going to them. Cindy O'Neill did a great shout out for the infection prevention and control team that also got an award. And then thanks to Liz Ferris and Linda Aliberti, who did remarkable comments about the ICUs and the great privilege in leading these areas, but also the phenomenal work. If you think about the number of people that have been redeployed to those areas, it's just a remarkable accomplishment. And again, we know that it takes many people to pull this off, but I'm very grateful for their leadership in all of this. So thank you for everything. I think, we've had lots of examples of we answer the call as nurses. Thank you to the many areas also who supported the week. I see on social media lots of shout outs by anesthesia and surgeons and you name it, lots of people are into this. So thank you for making it a fun week and really recognition of the importance of nursing in our healthcare field at large. So thank you very much, and back to you, Aaron.
Yeah, thanks very much, Kirsten. I'm just going to call out the fact that I have been having some audio issues. I did get a couple of comments from folks. It's hard to know, but if any of my panelist colleagues wanted to let me know in the chat or on through visual if I'm cutting out. I'm going to try and be a little closer to the microphone, and hopefully that fixes things. But I know I'm having a choppy internet day all around today, so hopefully this fixes it. But just wanted to call that out. We do have some time for a Q&A session, and I'll hopefully moderate that, audio permitting. I know our panelists have been diligently typing responses to questions that have come in and those answers are available in the Q&A tab. So if you open up that tab and then look at the top where it says answered, you'll see that there's a number of questions that you can scroll down and see the responses to those questions. I know there's been a lot around the vaccine effort, some posed ahead of Bruce's remarks, and he was able to address a lot of that content throughout his remarks. So a couple specific questions about healthcare workers qualifying for an expedited second dose. I think the response to that was really that there is information available at the link provided by Bruce, and we'll certainly be able to clarify as we move forward if there's any gaps. Another here about surprising that we have 17 staff and physicians with COVID. Is there any awareness as to whether or not these individuals might have been vaccinated or partially vaccinated? I know this topic has come up in the past before. I wonder if one of my panelist colleagues might want to take a stab at that question. Maybe, I don't know, Dr. Mertz, if you're aware, we actively, I don't believe we're as of yet collecting information available on vaccination status and wouldn't have that at our disposal. Is that accurate?
No, we are not systematically collecting that information. I'm aware that employee health would ask anyone who developed symptoms or test positive whether they got vaccinated. I won't have access to that information because I'm not employee health services, so I cannot share any further information on that. But again, I think it's also important to understand what we can expect and what we cannot expect from the vaccines. And while it's great vaccines in terms of preventing severe morbidity and mortality, we will continue to see infections, typically asymptomatic or mildly symptomatic in vaccinated people, even more so in people who only had one single dose. So it's not necessarily surprising. We've seen it with patients as well, that patients get infected despite one. Some may have had the 2 shots already. So it can continue to happen, but keep in mind that the most important piece we want to prevent is patients or people getting severely sick. And for that, the vaccines are much more effective than preventing mildly symptomatic or asymptomatic infections.
Thank you for that answer, Dr. Mertz. Question here about redeployed staff and who they might be able to reach out to with questions about a specific assignment. I'm not sure, maybe Sharon, if you could shed some light, or maybe Leslie Gillies, you could actually take that one on. Is there anyone that redeployed staff could reach out to specifically?
Yeah, definitely. I certainly be very happy to be that connecting point and make sure that we then further follow up with the right individual. So happy to be that point of contact.
Thank you very much. I see another question here about our staff working remotely survey that was distributed in January. I think there is a communique actually planned on that for this week. So I think to the person asking that question, more to come. Kelly Campbell, did you want to add anything?
No, I think you've captured it. There'll be, yes, a communication coming out probably tomorrow that will give some more detail.
Awesome. Very timely question. Good. Are there currently any pediatric COVID patients admitted at Master Children's Hospital? Bruce, is that the case? Can you get some light on that?
Yeah, thanks very much, Aaron. Yes, we have had patients with a COVID positive swab, really quite frequently, ranging anywhere from 1 to 5 over the course of really since the second wave, and that reflects the amount of COVID in the community. And our clinical colleagues, Dominic, might even want to comment. The vast majority of times, of course, that COVID positive status is incidental to the reason for admission, because certainly the incidence of any severe COVID related disease or conditions in the pediatric population is very, very low.
Good stuff. Okay, thanks, Bruce. I know there's a couple of questions still left in our Q&A section, but I know our panelists will do their best to answer those while we proceed. I'm going to suggest, given that it is National Nursing Week, we move to celebrations, as I expect There'll be much to celebrate in a week of celebration such as this. I would encourage everyone to do that by either typing something in the chat it out live, or you can also raise your hand as a panelist or as a participant, and we can call on you to be able to ask your question, or sorry, give your celebration live. I see Rob has joined me for this part of our agenda, so we'll have a chance. I'll take a quick scan here, see what
We
we've
do
got.
have one shout out from Danielle Fry, and shout out to the hospital to home team and the amazing work they're doing to support vulnerable individuals in the community. This team works with patients on their goals to promote health and wellness and tries to reduce hospital visits. So proud to work with this awesome team. Totally agree with that sentiment. Very innovative program that we've got at Hamilton Health Sciences, and very, very aligned with our vision for the future in terms of how we'd like to have a healthier population here in Hamilton.
Great. Do see a question there from Al Alapio. Al, if you could paste your question in the Q&A forum, I'm sure our panelists will have a chance to answer that one for you. If they don't get to it, we'll make sure to get you an answer regardless. Any hands up from our panelists or from our participants? Would love to hear a shout out from someone live. I see on our panelists, I have Bruce Squires. Bruce, go ahead.
Thanks very much, Aaron. Very happy to do a public shout out to Barb Jennings, the senior manager of patient safety at the Children's Hospital, who will be retiring tomorrow after a dedicated career as an RN, starting in our NICU and progressing. But as well, Barb has truly been the heart and the engine of activities to eliminate preventable harm to children, youth, and families. And so I know we're all sad to see her go, but wish her well.
Nice. Leslie Gauthier, please go ahead.
Yeah, thank you, Aaron. So I have two shout outs. One is I really want to acknowledge our clinical managers and their role in the redeployment process of supporting their staff that are being redeployed. I think they've had some really difficult, challenging conversations with teams and have really kept the big picture and trying to really support our COVID patients in those conversations. So thank you for managing those conversations. And my second, aligned with Bruce, is Kathy Diggin is retiring from HHS, and tomorrow is Kathy's last day. And she's had a very long career as a business clerk in critical care units. She has worked in the operating room and done scheduling and done supply chain, and just been a really, really strong asset helping our patients and teams. So I just want to wish Kathy all the best.
Nice.
Yeah,
Rob,
this is nice, Aaron.
How's our forum looking?
Yeah, so from Lindsay Kowalik, thank you to all the staff working in DI at the Hamilton General. You've all been working tirelessly through the pandemic and continue to provide excellent patient care each and every day.
Very nice. I see another one here celebrating all of our peers and colleagues who took time to nominate and recognize our excellent nurses. Thank you.
And then Tony DeBono, a big shout out to our Chief of Nursing Practice, Carissa Gordon, for an amazing nursing week. Totally agree. Great job, Carissa. Really nice event yesterday, and all the attendant celebrations that go along with it. So thanks, Carissa.
Good stuff. We'll give another call for any celebrations anyone would like to issue. Of course, you can also raise your hand and give one live if you'd like. I see Kirsten with a hand up. Kirsten, please go ahead.
Thank you. I do want to shout out to the respiratory therapists who have done yeomans in trying to cover all the demands during COVID. I had the pleasure of watching a little bit of that action on the weekend in the ICU at the General, just seeing the proning work that's going on and the coordination of a number of people to try and make that happen. But the RT was so effective in moving through that unit and helping to coordinate that activity with amazing staff who stepped in and helped to do that work. It's pretty phenomenal to see people in action. So thank you very much to our RT group in particular.
Nice. Sharon, I see you've come on camera. Would you like to give a shout out?
Yeah, actually, I'm relaying a message. We had MAC last night, and the chiefs had a message of acknowledgement for all their nursing partners and wanted to convey their great recognition and respect for the nursing team, and had asked that there be a conduit to send that message out to all those that are listening and all other nurses. So on behalf of our medical partners, happy Nurses Week, and thank you to all of you.
Wonderful. Thanks for doing that. Leslie Gillies, I see you have a hand up.
Thanks, Aaron. Yeah, I just wanted to thank obviously everyone that's been involved in every capacity, leaders, staff with deployment, taking care of our patients in the critical care settings, but also in the ward. As Sharon has pointed out, over 240 staff have been deployed, and through that process, those patients are receiving excellent care, and we're very, very appreciative. I did want to also recognize, though, the educators and the resiliency team folks that have also been there supporting the staff in this transition. And we believe that's been a great support, and I wanted to acknowledge those folks as well. So thanks very much.
Thanks for doing that.
A couple of shout outs, Aaron, in the chat box. One from Hassan, let's say Zaradine. Hopefully I got that right, Hassan. Celebrating the malignant hematology team who kept our vulnerable patients safe and units free of outbreaks throughout the pandemic. Great work.
See another one here from Patty Ann Allen, the allied therapy staff at the Satellite Health Facility, and filling some of the gaps in rehab during the COVID efforts. Many patients have been discharged directly home after receiving excellent therapy there. Thank you very much, Patty Allen. And
another one from Carissa Corden, who is thanking the whole planning committee for Nursing Week. Carissa's a prolific typer here. I wonder.
Sorry, I'm really good at this, Rob, from our long service resort.
All right,
Run through the
take a run at it.
Diana Crasulia, Dorothy Petty, Daniela Troiani, Romaine Sheriff, Sarah Kwan, Anna Palmieri, Laura Harsbort, Jennifer Lounsbury, Tony DeBono, Leanne Tremaine, Cassia McNeil, Peter O'Sullivan, Mark Gorel, Sarah Romerl, Lillian Reynolds, Angela Felice, Amanda Stancati, and Janice Collins. So there we go. There's the rundown, and we're putting them all in.
Shout out to Aaron for having read that long list of names without mangling any pronunciations.
Well, I can't wait to get back at it with the next long service awards. Anyways, why don't we close it out there, Rob, and I'll hand it to you for final closing remarks.
Yeah, sure. Maybe I'll just note Dr. Kelly has a shout out there to all the perioperative nurses and surgical ward nurses for the amazing work they do each and every day. Nursing Week is a super important week in the life of our institution, because nurses play such a massive role across so many different parts of what we do in administration and on the front line and every position in between. So happy Nurses Week to everybody one final time. Thank you very much for all that you're doing. And thanks to everybody for coming today and attending. We promise we are going to work super hard at finding a solution to getting those second shots out. I responded to a few people that, we kind of didn't have a lot of notice, and that, we're the ones who have to implement somebody else's announcement. So, but we are on it, and we will get back to you ASAP. So thanks, everybody. Have a great rest of the week.